Hi, I'm Colin Hung from Healthcare IT Today, and I'm sitting down today with Suzanne Clough, Chief Medical Officer at ArmadaHealth. Suzanne, welcome to the program and thanks for sitting down with us.
Thanks, it's nice to be here.
You have a very lovely setup. Thank you very much for taking the time to get your video and everything set up just right. It looks beautiful.
Well, you can thank my parents. I'm squatting at their house for this interview, so.
I love it. I love it. Suzanne, let's get right into it. You wrote a piece which I found very interesting where you talked about patients that are in this sort of second wave of the COVID-19 pandemic. These are the patients that have chronic conditions, people who may have cancer diagnosis or maybe at the beginning of a disease journey who are now, of course, not able to take advantage of any of the healthcare services because everything has been on lockdown for so long. How are these patients coping?
Yeah, it's from what I understand, there's a lot of mixed experiences out there right now. And it also depends where you are in the country, whether you're considered a hot spot or not. I have had some friends who are patients tell me that the new telehealth experience now that's here is amazing. Why haven't we done this sooner? Why did I have to spend 2 hours going for a 15-minute follow-up? So that's some of the positives. And then I know, people who've had recent cancer diagnoses and they are considered quote unquote low priority for, a follow-up or a workup or to have, a biopsy from a clinical perspective. But imagine from a personal, emotional perspective, right? There's no low priority in that. And then we're also seeing across the country decreased acute care and necessary ER utilization because people are afraid. So there's a lot going on out there where people just are not getting the health care that's necessary and important, either physically or mentally, that we need to start having open dialogues about.
So it sounds like there's some patients who are likely managing and coping okay, given that there is some access to telehealth, but there's a number that maybe aren't because of the anxiety or just simply because they needed to have that surgery or that procedure done.
Correct. And I've talked to some folks where they're just, the number of cases of COVID have decreased, restrictions have been released, and they're feeling some normalcy. There may not be as many furloughed healthcare workers in those systems, so they're not feeling it. But when you look at other parts of the country where the furloughs are real, 3 to 10% of the workforce, even if patients aren't afraid, sometimes they're just finding it hard to even find a physical body to see them at this point.
I was going to ask you about that. Now that we're sort of in the starting to talk more about recovery than we are about the disease, the pandemic, what's going to happen, and what do you foresee for these patients when they come back into the healthcare system? I mean, is it going to be pretty much a return to normal? Is there going to be something that's really different about that experience when they come back?
I think a lot's going to be different. Some is going to be annoying, right? But some's going to be great. I mean, this whole telehealth, you've been doing this a very long time. Have you ever seen anything from an innovation perspective just blow up like it's blown up? Telehealth has been around forever, but it's always struggled with the regulatory red tape, right? To just get out there. What device can patients use? So this will be, I think, something that's going to change the way remote monitoring, digital health, telehealth is out there. I think we'll see that change. But I don't see widespread access coming back anytime soon, especially with the talk of what's going to happen in the fall and the winter. Health systems are really trying to figure out, all right, how do we scale up a bit, but not so much that we're not prepared if that happens, right? We need our personnel not burned out. We need our PPEs. We have to have a strategy for beds and ICU units. So even if the rest of the country or parts of the country feel like things are getting back to normal, hospitals are thinking forward and therefore, not increasing their capacity at this point to full time. So that's kind of one piece at the system level. And then I think, the prevention, not contracting the virus, all of these measures are still going to have to be in place. I foresee us walking into buildings and have to hand sanitize, have the masks on, keep your distance. And again, the distance thing then will mean less people in a clinic waiting room. So there has to be less bodies. And again, this loops back then into, we need a really smart telehealth strategy. People should only be in those offices in this near term if they really need to be. So thinking through who's right for the in-person visits and who can be managed, well enough with the telehealth. And then, the other thing that I would love to just have the opportunity to talk about is people need to advocate for themselves at this point.
Mm-hmm.
Ask the question, what are you doing to make sure I'm safe? Is someone cleaning the rooms in between the visits? Are you testing your healthcare employees? Are they wearing masks? Like, this is now not the time to be shy and be afraid to advocate for yourself. I feel very strongly about that because I'm hearing and seeing different degrees of infection prevention in different systems, and people should be aware of that.
You bring up an excellent point. I mean, we've always talked about patients being their own advocates and having a stronger voice. Now is the perfect time, if any, to make sure that that voice is heard. Asking the simple questions like you just said around how is the cleaning done here? How frequently is it done here?
Right.
What do you wipe down? What don't you wipe down? It will be, those are the simple questions you should and can be asking, all the way through to, what's your staff doing to protect themselves and the patients when people do come in? It's not something that patients are used to asking though right now.
It's true.
I just want to refer back to something else that you wrote about in the past, something called clinical navigation services. And the reason why that piqued my interest was because you referred to it as something that will be critical to safeguarding high quality care. Can you maybe expand on that for us?
Yeah, I mean, the reason I joined ArmadaHealth in the first place, because I just feel like this whole clinical navigation piece has been missing for so long in the healthcare system. I mean, there's been zero transparency, right? For you as a consumer of healthcare, I mean, it may be, or you're in Canada, right? It may be different there, but here, there's no source of truth of who really does what and who really does what well. And in the United States, the healthcare system now is so subspecialized, right? The ophthalmology, the eyeball has 11 subspecialties. So if you have a retina problem, you don't want to go to an ophthalmologist. You want to go to an ophthalmologist who's a retina person. And so we see the third leading cause of death is medical error. And a lot of this is sometimes because people end up getting the wrong care from the wrong doctor. So for me, the clinical navigation service is companies like us that invest very heavily in data and data science so that we learn who's out there, who's good. We're not looking necessarily to slam doctors, right? We're just trying to find who does what, who does it well. And then when a patient needs a doctor for that condition, it shouldn't be so hard. We want to be able to offer up, here you go, in the right geographical location, someone who takes your insurance, still is accepting new patients, and has an area of clinical focus around the condition that you have. Here's 3 choices, and they're good. We vetted them for that. So it's really to help people navigate a system that historically has never given them a roadmap. And why I feel that's really important now is, if you think about access is going to be down, right? There's fewer providers, healthcare providers out there, just because of what's going on. Fewer, less access to someone who will perform elective procedures. That's a lot of time that people don't have to be picking up the phone and calling. Clinical navigation services can help someone do all the grunt work, and find the right doctor.
I mean, you make it sound so easy, but I'm assuming, given what Armada does, that's not quite so easy to match and get all the parameters to match a patient's needs right up to a physician.
I mean, it's not. We've been building our knowledge base for 12 years, but we're trying to do it smart. So we're trying to rely on the advances in data science. But anybody who works in healthcare will tell you it is the messiest data in the world. So we also invest very heavily in having physicians, researchers, healthcare economists help us look at the picture more holistically and say, you know, when you're looking at care or quality, you got to look at it in the big picture. So we try to understand, is someone providing care that's good? Is it appropriate, right? Someone could be the best back surgeon in the world, but do you really need that back surgery?
Right.
And care that's patient-centered. So it is tough because we are trying to paint that holistic picture so that, you know, someone can have a really nice experience when they walk in and sit with the physician. And on the flip side, Colin, you know, we want doctors to be able to practice what they love to practice, right? I mean, there's a stat out there that 40% of initial consults are people who really shouldn't be with that specialist. It maybe be the wrong subspecialty. And so why doctors love what we do is we're sending them patients that they want to treat, that's kind of their bread and butter.
And just because I think people in our audience will be curious, how do you gather all this information about the physician? Is this publicly available data? Is this information that the physician has to provide to you in order to build their profile?
Some of the data that we get is publicly available, but to be quite honest, we've had to spend an enormous amount of money to procure private data sets that's out there. And so we look at, you know, when you go see a doctor, they bill for the service, and through that billing, we get claims data. And so we tease through that, trying to understand, okay, who's walking into that physician's office? What type of conditions are they treating? And then we look at other data sets. Well, how are they treating it? What's the procedure? What's the medicine? What's the approach that they're using? And then we do, you know, look for some more subjective information. You know, we don't rely too heavily on patient reviews out there because a lot of times it really has nothing to do with the doctor, but may have to do with the office staff or, you know, the wait time. But so we spend a lot of money. We look at a lot of different data sources, and then we have to make that data become information. So we spend a lot of time with our clinicians building the logic to evaluate that data as it pertains to a certain specialty or subspecialty.
Love it. And I really love how it is scientifically based. I mean, you're not just looking at, like you said, the ratings or a review or two. You're really incorporating the hard data from claims and doing your own analysis on it. I think that's amazing. Which leads me to the next, leads me to the next question around, in your mind, what is the ideal patient experience? Like, how, if someone was using your software and your solutions, like, what would the patient side experience be like?
Well, I'll give you two stories. One is what would be ideal without us, right? So, and it seems so simple. You either go to your payers, your health insurance provider directory, or you get a referral from your physician, and it would be very clear that that doctor specializes in your condition. You'd call them up, you'd know they take your insurance, you'd know they'd have appointment availability, that's, you know, commensurate to your clinical condition. You'd be told everything you need to know to show up for that visit and be prepared. You'd go in and you'd have a great conversation, right? And just too often that's not happening. Actually, they say that health plans, provider directories have 50% of the mistakes that are in those directories actually preclude people from access to care. Wrong address, wrong number. So that's a mess. So that ideal journey just is not happening. For us, what we said is, let's look at those pain points and make it really easy for someone. So if someone has our clinical navigation service benefit, they can use our online form. It's really simple. It takes 2 minutes. They just tell us what the condition is, the specialty that they've been told, specialists they need to see, what their insurance is, and then our platform narrows everything down, relevant by the most relevant physicians based on their clinical training, their area of clinical focus, and then all of the patient's inputs, what gender they might want of their physician, the distance, the insurance. And then we have a research team that once we narrow it down, we'll actually call the offices. Again, because healthcare data is so messy and physician contracts with payers change so frequently, that we want to be able to say, oh, look, if Colin says he has X condition and we want to give him 3 physician recommendations, we want to make sure all of that data is correct. So we call and verify. We call it the last mile verification. So your journey is simple. I've been told I need to see this specialist. I go to, ArmadaHealth product, boom, 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 put it in. The system evaluates it. There's a clinical navigator who reviews it and makes sure it's appropriate. A research team will call. Oh, the other thing we do when we call the office is, what do you want this person to do? Tests or labs or consult notes. What do you need from this patient to show up and just hit the ground running? So the patient then just has to sit back, accept the email, and open it up, see the recommendations, and it's done.
Wow. I mean, it sounds so logical to be able to walk into the specialist that you're seeing with all the right prerequisites done. But just based on what you said, there are probably a lot of patients who go to the appointments today and only to realize, oh, they don't have 5 things, and they have to come back again, which is not an ideal.
It's maddening. Yes. We want to just take all of that out of the equation.
So if I was a payer or a provider, is there anything I can do to prepare for the implementation of a system like yours? I mean, is there a cleanup I can do? Is there information that I can provide just to make it a lot smoother?
Yeah, I mean, we have lots of ways to implement. I mean, our whole philosophy is, listen, a lot of organizations have already invested very heavily in their health IT infrastructure, right? Whether that's technology, whether that's human case managers or caregivers or navigators. So where we really evolved over the last year is it's simple. It's either we can run this whole clinical navigation for you through, let's say, the Quality Care Connect program. We have a little microsite. We'll put it on your website. We make it easy. We take care of everything. We're providing the navigators. We'll white label it. There's that. But the strongest feedback we've gotten in the last year from the plans has been, listen, we have these provider directories already that are there. We have these call centers are there, but we need the intelligence that you have. So if we give you our eligibility file, here are our providers in our network. What we want back from you, Armada, is the ability for our human capital, nurses, clinical navigators, to be able to access your information through an agent portal. So we have now in the last year rolled out this other product, Quality Care Navigator, where it really is navigation as a service. The health plans can use their own staff and team, but use our system in the back end, and we still have our researchers there doing the last mile, so that members of the health plan within 1 to 2 days will get the recommendations back through their their system, but again with all of the information validated.
We're getting close to the end of our time together, so I have to ask, what's next for ArmadaHealth?
Oh, lots of good things. Yeah, we're really starting to talk a lot more with the plans about how our physician insights can help leverage the assets that they have. So that's one exciting piece. But then the other is we're really scaling up and through our platform that we've been enhancing over the last year to be able to deliver this clinical navigation service to hundreds of thousands more patients in 2020, 2021. So that's great. I mean, we really are mission driven. We want to help as many people as we can because we believe it's the right thing to do.
And final question, Suzanne, if I was looking at telling our audience what's the one thing you want them to take away from this conversation we've had today, what would be that one thing?
Don't find your doctors on Facebook.
So simple yet so profound.
Yeah.
I love it. Suzanne, if people want to find out more about ArmadaHealth, where can they go?
They can go to ArmadaHealth.com.
Awesome. Well, thank you so much for your time today. You've shared some great information. I truly appreciate it.
All right. Thanks, Colin. Thanks for spending the time with us.
This is Colin Hung from Healthcare IT Today. Thanks for watching.